Have you ever wondered why ADHD seems more common in boys than girls? Well, it might not be as simple as you think. Today, we're diving into the world of ADHD in women and why it often goes unnoticed. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Let's start with a surprising fact. ADHD is diagnosed about 3 times more in boys than in girls. And here's the kicker. This doesn't mean that boys are more likely to have ADHD. It's just easier to spot in boys because it looks different in girls. So what's going on? It all boils down to how ADHD shows up differently across the genders. So let's break this down. In boys and men, ADHD often looks like hyperactivity, that classic bouncing off the walls energy, impulsivity, blurting out answers, making rash decisions, disruptive behavior, getting into trouble, difficulty following rules. In girls and women, it's more subtle. You have inattentiveness, difficulty focusing, especially on boring tasks, disorganization, constantly losing things, struggling with time management, and emotional sensitivity, intense emotions, and difficulty regulating moods. And here's how this can play out in real life. A man with ADHD might fidget constantly in meetings, make impulsive decisions like quitting a job without a backup plan, engage in risky behaviors like speeding. A woman with ADHD might seem to be listening but actually be lost in thought, constantly misplace important items leading to chronic lateness, feeling overwhelmed by daily tasks leading to procrastination. These are all typical findings, but both sexes can exhibit any of these symptoms. But these classic differences often lead to women being diagnosed much later in life, sometimes not until adulthood. And this delay can have serious consequences. A 2019 study that I'll have referenced in the description found that women with ADHD were more likely to have additional psychiatric conditions, less likely to be in full-time employment, and more likely to be divorced compared to men with ADHD. Now let's talk about hormones. For women with ADHD, hormonal fluctuations can really shake things up. Many women will report that their ADHD symptoms change throughout their menstrual cycle, especially in the 2 weeks before their period starts. And this is because estrogen and progesterone levels affect dopamine function in the brain, which is a key player with ADHD. Pregnancy and menopause can also impact ADHD symptoms. Some women find their symptoms improve during pregnancy, while others don't notice much change at all. The postpartum period, with its rapid drop in hormones, can worsen ADHD symptoms. And then there's menopause. The decrease in estrogen can make focusing and regulating emotions difficult, even in women without ADHD. Another difference between men and women with ADHD is the other conditions that often come alongside it. Men with ADHD are more likely to have substance abuse disorders, disruptive behavior disorders, and risky behaviors. Women with ADHD more commonly experience anxiety and depression, sleep problems, and emotional dysregulation. And these differences can make diagnosis tricky. A woman's ADHD might be misdiagnosed as depression or anxiety, leading to treatment that doesn't address the root cause. Now, to be clear, depression can disrupt your focus, concentration, and motivation. So distinguishing between these two is tricky. They can be present together. They're not mutually exclusive. So what can we do with all this information? If you're a woman and you've always felt different but never understood why, consider the possibility of ADHD. Don't let the stereotype of the hyperactive little boy keep you from seeking help. Look for things like chronic disorganization and forgetfulness, difficulty starting and completing tasks, feeling overwhelmed by daily responsibilities, having a history of underachievement or frequent job changes. If you're a parent, teacher, or healthcare provider, be aware that ADHD can look different in girls. Watch for signs of inattention and disorganization and not just hyperactivity. For those already diagnosed with ADHD, understanding these gender differences can help in managing your symptoms. For example, women might benefit from tracking their symptoms in relation to their menstrual cycle. Hormonal treatments might be an option for women whose ADHD symptoms are significantly impacted by hormonal fluctuations. And both men and women can benefit from cognitive behavior therapy. And remember, ADHD is a real neurobiological condition. It's not about laziness or a lack of willpower. With proper diagnosis and treatment, both men and women with ADHD can thrive. Treatment might include medication, therapy, lifestyle changes, and support groups. If time management and organization are issues for you, check out my videos on skills training for ADHD. Thanks for watching today. See you next time.